pregnant with our third, I began having chest pain. Went to the ER a couple times, was kind of diagnosed with pregnancy-related reflux. I was lucky enough to come back to my hometown, Omaha, on a weekend and called up my OB and said, hey, I just don't feel right, I feel really bad, and was lucky enough to find a spot on my lung and eventually made my way to the med center and was diagnosed with synovial sarcoma. Pretty aggressive at the time, so we went ahead and had a thoracotomy while I was 5 months pregnant, which was removing the lower section of my lung, which was a little tricky for both our baby Ethan and myself, but we got through that. I started chemo while still pregnant, and we decided that was safe for Ethan and finished 2 rounds. Had Ethan five weeks early, Ethan Matthew, and he's doing well. He just turned 2 a week ago. Then started some pretty aggressive chemo, which was inpatient here at the med center. Got rid of the tumor and kind of was going about our life and doing well for 8 months when one of my routine scans came back positive that I had another tumor on the other side just above my kidney. So we started radiation and chemo again, and then I had that tumor removed. Had another glorious 4 months of no cancer, and it came back in the original spot this last spring. Cancer provides you with one thing, it's a survivorship. People just come out of the woodwork. People that you may have only known as an acquaintance start helping. The ladies on the nursing floor and in the infusion center, I mean, you're here, for weeks at a time, or even if it's just, a day, they go above and beyond what they need to do to become your friend and make sure that you have a support system and make sure that you feel loved and that you'll get through this and that they will help you get to the other side of this as best as they're able. Right now, because there aren't any tumors showing, I have CT scans every 3 months that will show if there's anything growing. As a 3-time cancer surviving patient, it just is crazy. You want the day to come so that somebody will say, you don't have any tumors and life is going well and you go out and continue to live your life, but you also don't want the day to come because it comes, it may come with bad news and restarting, treatment.
Hey, there we go. Get rid of that. Yeah. Okay.
You came in fast, so I felt pleasant.
Just got the great news that I had a clear free scan today, so no treatment right now and life is good. My husband, when I was basically living here, stayed every single night with me, and the nurses are wonderful to kind of do anything that they can to make a better experience for you. And the fact that I can come here, which is luckily in my hometown, and I don't have to travel, hours each time for an appointment, I'm very blessed to have this right here in my town. The mental part of cancer is as difficult as the physical part, and so if anything, that's what I want people to know is this, will not be your end. You've got options.